One of the biggest misconceptions I hear is, I need to find the best therapist, but that's actually the wrong question. The better question is, who is the best therapist for me? Chicago has an incredible mental health community. There are therapists who specialize in anxiety, others focus on trauma, some work almost exclusively with ADHD, others specialize in OCD, eating disorders, couples therapy, or child and teen therapy. Having options is a wonderful thing, but it can also feel overwhelming. Today, I'm going to walk you through how to narrow those options so the process feels much more manageable. One of the biggest mistakes people make happens before they even contact a therapist. Most people start searching before they've taken a minute to ask themselves what they're actually looking for. You don't need a diagnosis. You don't need everything figured out. But it helps to slow down and ask a few simple questions. What feels hardest right now? Is anxiety making your everyday life feel exhausting? Are you struggling with attention or executive functioning? Have relationships become more challenging? Do you want practical coping skills, or are you hoping to better understand yourself and process emotions? Even having a general direction makes it much easier to find someone whose experience matches your needs. Before you even start looking, it can help to pause and reflect on what you want support with. What's been feeling most difficult, and what has or hasn't helped in the past? Another thing that can feel confusing is all the different therapy approaches. You might see terms like CBT, DBT, ACT, EMDR, ERP, psychodynamic therapy, or person-centered therapy. At first, it can feel like you're learning a whole new language. But the good news is you don't have to become an expert before starting therapy. Cognitive behavioral therapy, or CBT, is often used for concerns like anxiety, depression, and OCD. It's structured and focuses on the connection between thoughts, emotions, and behaviors. If someone is working through trauma, they may benefit from trauma-focused approaches, including EMDR. If you need help with an eating disorder, DBT and ACT are often helpful therapy approaches. Other therapists use psychodynamic therapy, which explores how earlier experiences may influence current emotions and relationships. And person-centered therapy emphasizes emotional safety, understanding, and personal growth. Many therapists actually integrate multiple approaches rather than sticking to just one. The most important thing is finding someone who can adapt treatments to your needs. Here's something that's actually more important than the therapy method itself. Research constantly shows that one of the strongest predictors of successful therapy isn't the technique being used. It's the relationship you build with your therapist. That means, do you feel heard? Do you feel respected? Can you speak honestly without worrying about being judged? Those questions often matter just as much as credentials. Of course, credentials are still important. In Illinois, you'll typically see licensed professionals like LCPCs, LCSWs, psychologists, and psychiatrists. It's also helpful to find someone who regularly works with the concerns you're bringing into therapy. If you're dealing with OCD, someone who specializes in treating OCD will be quickly able to recognize OCD symptoms and patterns and more effectively treat you with ERP, exposure and response prevention therapy, which is the gold standard therapy for OCD. The same is true for ADHD, trauma, eating disorders, or couples therapy. You should absolutely look for therapists who specialize in these areas. So where do people usually begin their search? Most people either search online or ask someone they trust. Common places to search online include therapist directories like Psychology Today, insurance directories. Practices with multiple clinicians can make this process easier because you're not starting over if the first therapist isn't the right fit. Instead, they can help you match with someone who better fits your needs. At Cityscape Counseling in Chicago, we have a large team with a diversity of therapists who specialize in all of the above-mentioned therapy approaches and diagnoses. Now let's talk about one of the biggest questions almost everyone has: cost, insurance, and virtual therapy. Therapy in Chicago can look different depending on your insurance and budget. Some therapists are in-network with insurance, others provide super bills for out-of-network reimbursement. Some offer private pay or sliding scale options. If cost is a concern, community mental health centers and university training clinics can also be excellent resources and may offer pro bono sessions. At Cityscape Counseling here in Chicago, we are network providers for Blue Cross Blue Shield PPO, Blue Choice, Aetna, Cigna, and United Healthcare. Our out-of-pocket rates are $160 per session. We do have some sliding scale and pro bono slots too, and are in the process of becoming a network with Medicaid. Another decision you'll make is whether you prefer virtual or in-person therapy. The encouraging news is that both can be highly effective. Virtual therapy offers flexibility and convenience. In-person sessions may feel better if you prefer a dedicated therapeutic space with fewer distractions. For many people, it simply comes down to personal preference. Many people also worry they'll have to commit after the very first appointment, but your first session is really just an opportunity to get to know each other. It's completely okay to ask questions like, how do you usually work with concerns like mine? What does progress typically look like? How structured are your sessions? What should I expect in the first few weeks? You're interviewing them just as much as they're getting to know you. One question I hear all the time is, how do I know if I found the right therapist? Often you just begin to notice it. You feel comfortable talking, you feel listened to instead of evaluated. Sessions feel organized. You leave with a little more clarity or hope than when you arrived. And if it doesn't feel like the right fit, that's okay too. Finding another therapist isn't a failure. It's part of finding the support that's right for you. One final thought before we wrap up. Therapy usually isn't about one breakthrough conversation. Real progress tends to happen gradually. It comes from showing up consistently, practicing new skills, being honest when something isn't working, and allowing trust to build over time. Those small changes often turn into meaningful changes over months. If you remember nothing else from this video, remember these 3 things. You don't need the perfect therapist. You need someone who feels like the right fit. Look for experience with the concerns you're bringing into therapy, and give yourself permission to change therapists if the relationship doesn't feel right. Finding the right fit is part of the process.